All right, you guys, real talk. What is the scariest complication as a plastic surgeon that I worry about in my patients? Well, it's not an infection, it's not healing issues, it's the development of a blood clot in your legs that can dislodge and go to your lungs. So why would this happen with surgery? Well, anytime that you are immobilized, you're gonna have blood that's pooling. And when you have blood that's just kind of sitting around stagnant, your body's propensity is to wanna clot that blood. Typically with immobilization, we see this develop in the lower legs, and we call it a deep vein thrombosis. Now, luckily, this is a really rare thing to have happen, and it's a known risk factor, and so we definitely take precautions. One thing that we do in all of our surgical patients is put squeezy boots on your legs. We call them pneumatic compression devices. Basically, while you are immobilized and under anesthesia, your squeezy boots are going to be moving blood through your lower extremities. The second thing is that with every single one of my surgical procedures that I offer, I want you up and walking around the same day. It is really important that patients are not on bed rest after surgery, because flexing your calf muscle and walking around is the best way to get blood flow through your legs. Now, aside from just having a surgical procedure, how do we determine your individual risk factors? Well, there's something called a Caprini scale that I follow and most plastic surgeons follow in order to determine what your risk factors are, how high your risk factors are, and whether or not we need to put you on blood thinners before, during, or after your surgical procedure. Now, a typical protocol that I would have for anticoagulation after surgical procedure would be a once-a-day injection of a blood thinner for 7 days after surgery, which we will teach you how to do before you leave after having your surgical procedure. So in the end, I don't really care how much it hurts. That's what pain medication is for. Get up, move around after your surgery. You are not on bed rest.